so the first PNF technique that we're going to review is scapular PNF, slow reversals. And the first diagonal is anterior elevation to posterior depression. So we're going at this angle 30 degrees from midline. So she should be aiming to, when she finishes, the tips of her shoulders should be 30 degrees forward from straight up and down. So it's important for the patient to have their feet firmly planted on the ground. And if they can't quite do that, sitting back on the stool, just have them scoot forward a little bit. And then myself as a clinician, my knee is going to be up against the stool. So that way she doesn't tend to roll forward or backward. It's also really important that the patient has good upright posture and that their core is engaged so that when I'm pulling pressure and pushing pressure, they don't lean back and forth. So they have to engage their abdominals. So the cues for this one is to pull the tips of your shoulders up to your nose and push your shoulder blades down and back into the opposite pocket. And those are the cues I find that work most often. The scapular PNF is very common that you'll have to say, you're doing this, I want you to do this. And so you'll notice that Carolyn and I are facing a mirror over here. And so that way she can see what she's doing, and that really helps with the correction of the technique if she's doing something wrong. You really, as a clinician, want to watch for a lot of protraction or slumping posture and a lot of forced extension to try to get the motion that you're asking them to give you. And so her glenohumeral joints should essentially be moving in a straight line. There shouldn't be a lot of arcing motion when she's doing this pattern. Okay, so Caroline, you're going to pull the tips of your shoulders up to your nose and then push down and back. Up to your nose, good. Push down and back. Pull up, pull, 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 good. Push down and back. Pull up and forward. Push down and back. Up, good. Push down. Keep going. Pull up, push down. One more. Keep that posture up. Push down. Good. And so you'll notice that my hand placement is just on the medial border of the scapula, kind of down onto the inferior angle to give me a little bit something to grip onto. And then for the anterior hand placement, I'm basically just slide around onto the anterior deltoid and kind of distal pec.